afternoon and welcome to the Post-Adoption Center chat for the quarter. We are pleased to have you with us as we talk today about implementing TBRI in post-permanency programs. And you all are really in for a treat. We have the state of Utah, Aubrey Myers, presenting because they have implemented TBRI statewide, as well as their state partner, Brandy Naylor with Raise the Future, who is their partner for TBRI. So again, welcome. I would like to thank you all for joining us. And we are going to get started. I do have a very limited PowerPoint, but no fret, we are going to make sure that you get all the information that you need from this session today. So I am going to share my screen and I will turn it over to Aubrey to get us started.
Good afternoon. Like I said, I'm Aubrey Myers. I've been with the state of Utah almost 28 years. I've been in the post-adoption arena for 26 of that almost 28 years. I've done this a really long time. So, the first kind of question is, what did Utah use before implementing? I can tell you in the early years, late 90s into the early 2000s, we didn't do anything. We had the adoption training that we did for in-service training. Should I have done Brandy? Brandy, why don't you go and introduce yourself before I keep going? I forget about that part.
No worries, no problem at all. So yes, I'm Brandy Naylor. I'm the VP of Programs in Utah with Raise the Future. Also been in child welfare for a little over 25 years, but been with Raise the Future for a little over 11 years.
Like I was saying, originally, when I first started doing this, we didn't really have any kind of in-home interventions we had like our family preservation and things like that through the state. But we really didn't do anything for adoptive families. In fact, I'm probably the third or fourth post-adoption worker in the state of Utah when we originally kicked off the programming. And after, I think, December, I'm the last one of that group to be here. Because we're all starting to retire. We really didn't start doing anything probably until 2004, 2005. We picked up the Pathways or Parents as Tender Healers program, where we really kind of kicked off looking at trauma within our adoptive youth. And because prior to that, that's predates even our movement towards trauma informed. And you guys may hear me say trauma responsive. I think we're good at being trauma informed. I think we understand for the most part. Those we work with have a lot of trauma. The issue now becomes, what do we do with that? Are you having a hard time hearing me? The way they have our offices set up, the microphone's way over here. So I'm going to back up a little bit. Does that help? Okay. So I use the word trauma responsive because once we know that somebody has trauma, what do we do with it? And that's what I like about TBRI, because it offers us the ability to do something about it and be responsive to a young person's trauma and the vicarious and secondary trauma that happens in homes where we have, kids with lots of behavioral concerns connected to their trauma. So we did Pathways for a while. We probably did Pathways for 6 or 7 years. And we would do that statewide. Utah's broken into 5 regions. Each region has I'm hoping to change the name, but we call them post-adoption teams. Currently we have 16 dedicated clinical post-adoption workers in Utah. Each of the clinical post-adoption workers are TAC or training to adoption competency certified, and they're also all TBRI practitioners, which has been really nice because we have a really good base of folks who have long-term clinical experience in this field. But we did the Pathways, and it was an 8-hour training. So from a double policy standpoint, we did include that in our policy to say that a parent prior to adopting had to take the PATH class. And in conjunction with that, when we switched to TBRI, we put that into policy. We changed PATH training to the TBRI training. So our parents have to take that. The only thing that I wish we could have done different in that arena was that pathways, we really concentrated on 90 days post-placement to take the training, at least 90 days post-placement, because it's not always easy to understand what we're talking about in this arena until you've had experienced some of those things. And we've gotten through some of maybe the honeymoon stuff that might happen with our kids, and you really begin to see the true behavior behind these kids. And some of the stuff they do that just doesn't seem like that's a myth, that's a fairy tale. Kids just don't do that. But once you experience some of those things, then our families were like, okay, now I get that. And I think we thought that the PATH training could help families. Now that I know what it looks like, how do I manage it? But with TBRI, we didn't do that. We just say that TBRI should be taken prior to adoption. And the other thing I didn't care a lot about was we didn't make them retake, if they did PATH, they were still allowed to be, that was their training they could have had. But since we haven't done PATH in quite a few years, so those parents are not so much around anymore that they're saying, I took a training, I don't need to do this one. But we do have it required in a policy. So around 2017, we had a group of just post-adoption folks in our state who decided they're going to go do this training, and they went off, paid their own way, did it all on their own, and took the TBRI training. And they brought it back to Utah. And then so it's very grassroots, and they just started using it. It came to the attention to my predecessor. Some of you may know her, Marty Shannon, who was in this position before I was, really caught on to it as well. Oh, sorry, I was reading the comment. So Marty Shannon kind of picked it up, and we brought a private practitioner in the state to us, and we used to do, when we had more funding, we used to do adoption conferences in Utah, and we would bring people in to talk about things related to adoption and post-adoption services. And we brought a provider in, and she gave us a quick and full day training on TBRI and talked a lot about it. And it kind of kicked off from there where we as a group said, we think we ought to fight to get this to Utah. So we worked with Marty, and she went to our administration, and she fought to get them to allow it. So initially, 2018, that happened. But then finally, in early 2019, our administration said, you know what, let's do that. And so they approved 10 of us at that time in 2019 to go get trained. They sent us all to Texas. They paid for everything. Sent us to Texas. Brandy was with us in that group, and they sent us to Texas to get trained. And it was quite awesome. It was an eye opener. I think it gave us that sense of, we know all of this stuff. We've done this for a long time. Now this gives us a tool to hit the ground running. And it's been really good. We got back from training. Every region, what part of our ask for them sitting to this training is we had to provide this training within our regions to our families and to our workers. And then at some point, they wanted us to give it to our birth families. And so we set out, every region set up their schedules. I was in the northern region of Utah at that point, which is kind of like what we call North Salt Lake to the Idaho border. And we set up a monthly training. Was it monthly, Brandy? Yeah, ours was monthly. Some did it quarterly. But we set out to do it monthly. But a few months after we got back from there, I got this position. So I am a trained practitioner, but I have done it very little in terms of, I probably trained for 6 months, and then I took this position. Just doesn't give me a lot of options to help train in the regions. But we have a lot of really good folks in the regions that do it. So in 2019 was where we really kicked off our statewide effort. We came back with 10 practitioners. We started talking about it with our providers. We started talking about it with anybody who would listen to us. Then we really saw our private provider community pick it up. We have, I don't know now, Brandy, how many that is, but there's quite a few of our private providers that now do TBRI along with.
Yeah, in the state of Utah, we have almost 80 TBRI practitioners total at this time. And there's probably more. Those are the ones that have registered and would like their information put out.
Yeah.
For people to know and be searchable.
And what we had now is last year, I believe it was fiscal year 25, or it was either 24 or 25. Our foster care recruitment, training, and retention is a contracted service. They're called Utah Foster Care Foundation. They have finally instituted TBRI as part of their training for new foster parents. So if you're a new foster parent coming in Utah, you will get the TBRI introductory series immediately during your training. And now a lot of folks are now offering the my brain just went blank, Brandy, what's that called? The longer term TBRI, the 20 hours.
The full caregiver series.
Yeah, the full caregiver series. They're now offering the full caregiver series through Utah Foster Care, through our regions. And Brandy, talk about what you guys do.
So we have a program, what was awesome is we aligned ourselves with the same policies that our DCFS partners do. And so we have a team of family support that are all also TBRI practitioners or trained in TBRI who have also taken the TAC class or NTI, which is the non-clinical through CASE. I put a little plug in there too. Which is the adoption competency piece. And so we've just aligned ourselves in the same policies and making sure that as they're doing all their trainings with DCFS as well as Utah Foster Care, that Raise the Future is also providing opportunities within those altering months to have a full caregiver series, to have implementation times, other trainings. We do monthly support groups, virtual. We also have been trained in Making Sense of Your Worth that helps support TBRI, if you haven't heard of that. We have a full team of coaches that after you've been trained in TBRI that you, most of the time, which I've fallen in love with TBRI because I've never in child welfare gone to a training where people ended and we're just out of there and we never heard from them again. Usually when they take a TBRI training, they're like, how can I do this more? And how does this look in my home or in my office or in the space that I'm working in? And so we now have coaches who are practitioners, family practitioners that go into the home to help implement those strategies. We also have a youth mentor who helps with the youth in the home that specifically to also implement those strategies in the way that youth can interpret them. We have a schools coach because also kids are in school just as much as they're at home awake. And so we know there's a need for that as well. And then we also now have clinical services where we are also working with a clinical team that is TBRI trained. I think is that everything? Some of you are on here from Raise the Future. If I missed something, go ahead and put in the chat if there's other things that we're doing. But we also do hold, as we were talking about the state practitioners, we want to be able to help support DCFS in this state implementation. And so Raise the Future is an ambassador org, so we are able of TBRI, and so we're able to hold a collaboration group with all of the state practitioners. And we hold that monthly so that it's a space where any practitioner in the state of Utah that is implementing TBRI, that they can come and collaborate with one another and making sure that we're supporting each other in their events, or if they're doing trainings or they need support in implementing it in their home programs in whatever way that there is an opportunity to meet and chat and talk more about those things. So.
Yeah, and I think, when Brandy brought up the schools, that we even now have our schools who are getting more and more interested in implementing TBRI. And in fact, in our initial group of 10 that trained, which was kind of set us back a little bit in terms of getting more training, is we had 4 of those folks leave and went to the school system. And are now using TBRI within the school system as they were trained to, they're practitioners. So they took it to the school system. And we have more and more school systems reaching out to us saying, we would like more TBRI training. And also our JJYS, our juvenile justice programs are interested and are asking for TBRI training. I do a regular daily meeting with JJYS through, I'm also the clinical administrator for DCFS in Utah. And we meet daily with JJYS and they've approached me about becoming, they want not just the overview, but they would like the full caregiver series. So we have, by the end of the year, we'll have, I think, 4 shelters, or one of our juvenile shelters in the state, also TBRI trained and using TBRI services within their facilities. And that includes our shelter systems, and that it will include some of our detention centers. Because we share these kids, these are our kids. In Utah, one of the things that's been really nice through this process is we've learned to start talking about the kids in care are our kids. They're not JJYS kids, they're not DCFS kids, they're not disability kids, they're our kids. And so we've had a lot more collaboration in Utah. And when we get a kid with some complex needs, where we can sit down and say, how was the best way to help this family be successful? And TBRI is one of those tools in the adoption arena. Like I said, we're TBRI and TAC trained. The training to adoption competency, we all spend almost 2 years next month that we've been, well, a year since we've been TAC, went through to train and completed the training and did the final test. But the training was 2 years ago and it's been very helpful. I think we find families more responsive because we're more responsive to their needs and issues. But yeah, we really are starting to see, like I said earlier, our partners have joined on. We have multiple mental health agencies have jumped on TBRI and have trained their staff. One of our goals is we would like our Utah's mental health system is in a Medicaid catchment system. So their Medicaid dollars go to specific areas in Utah under these contracted providers. We call them local clinical mental health agencies or local authorities. And we're wanting them to get on board with TBRI and become TBRI trained. Also TAC trained, because we do have a lot of those folks are getting it on their own. They're doing TAC and TBRI on their own, but as an agency, you're really not seeing that happen. So that's been really nice as we see, from a couple of workers, almost 10 years ago to we're now seeing a lot of our state picking up on TBRI and saying this is useful and it's helping. Even our families are encouraged about it. And we have a huge amount of families who are good advocates. Funding, that's always a difficult one because TBRI is not an EBP, so it's not Medicaid billable. But and I'll let Brandy talk about how she does it. But as a state, we originally got funding in terms of getting the training through our maintenance of effort money or our 4E savings plan for Utah. We dipped into that and got us all trained in 2019. That's how we kicked it off in our state in terms of that funding. We also use that funding in Utah. The way we structure post-adoption funding is that we have the 4E savings money, and then we also have the family adoption and support grant money that we use to help families pay for services that are not, sorry, I'm getting farther away from the mic again, are not necessarily, where TBRI is not covered or other things that can be very helpful for a family to provide safety in their home and keep their kids in their home, especially when there's high behavioral needs, is we use that funding to help cover some of those costs. It's not always TBRI though. We're lucky that our providers have decided to say, we will do TBRI with our families, but they basically don't charge for it at this point. It's just through basic therapy and working with families, that's how they're getting paid. But actually using TBRI, not necessarily something they're saying, this is a specific bill a parent's getting, but they are doing the work. That's how dedicated they are to it until they can get, one of our goals in Utah is to help TCU, and I know Brandy's doing a lot of work there, and she can talk about that, is getting TBRI moved up so it can become Medicaid reimbursable. Brandy, you want to talk about your?
Yeah, trying to find the mute button there. Yeah, well, because Aubrey had said that, like, they're using their Title IV and their adoption funds in different ways. We recently have been able to pull down some Title IV, but it's for our Dave Thomas Foundation for Adoption program. But we do have a TBRI practitioner that is specifically for those transitions with our Dave Thomas Foundation for Adoption program. that is also working on those transitions through a TBRI lens, and then also helping with the in-home coaching there. So that was part. So there's funding that we've kind of threaded in through different ways where that's one of our coaching positions, as well as we went to the legislature and said this was a need. We see a gap. We had the data of saying, these families are asking for that. And we fortunately was able to get legislative funding through a lobbyist and a lot of support from our DCFS partners. And then also a lot of philanthropy dollars. Like he said, on the clearinghouse, TBRI is promising, which is really great, and it gives us a lot of credit there. But as we need it higher so that it can be billable in the state of Utah. So we haven't been able to do that. So most of the time we're using TBRI because it's just the right thing to do, and finding any way that we can help fund it is kind of where we've pieced it together, and hoping that as we continue to get more data and how much families are asking for it and showing the outcomes, that there is a difference after having been trained or coached or exposed to TBRI, that there is a shift in change in thought and just capability too, that I think our families feel more capable of meeting the needs of the kids that are in their home after they've dabbled in TBRI a little bit.
Talk about camp.
Oh yeah, we also do camp. That's also, every year it's typically philanthropy dollars as well that we will raise for a camp. And so we will have post-adopt families come for the week, and they are spoiled in the best way possible, where the kids all go, they have a one-on-one buddy to get TBRI, just they're exposed to TBRI the entire time. The whole environment is a TBRI environment. The buddy is trained in TBRI. It's an adult buddy that is one-on-one the whole time, where the parents also are able to go to class and do some implementation exercises and support group for themselves too. And then we end it with a little bit of respite time for them too, where the kids are still in their classes and the parents get to get away for a few hours. That's always a big hit every year. I think there's a lot of things we get from that as professional development for the professionals that are there helping, but also families building their own support group as they're there, and kids being able to make friends. We have families that every time they go to camp, they're still doing respite for one another. And they now have this common language of TBRI that when they get together, they understand and can support one another more. Yes, it's the whole family. We don't exclude anyone. So it's the entire family that comes.
It is really a goal that we treat the family, not just the adopted kids. Even in Utah, we can use some of our funding for the family in general. We just have to really know that it's serving the family.
True. They have helped a lot with like mileage and things like that, and ways to make sure families can show up if they do need a hotel the night before they get to camp or something like that. Our partners at DCFS have been amazing at making sure our families get there.
I wish I had more to say about data. There's a lot of things that I think we need to do to improve data. What we do know and I don't have that number, but we do track everybody we train every year as post-adoption, but also our Utah Foster Care Foundation tracks as every family who receives a foster care license is TBRI trained, at least the introductory. The full caregiver series is optional for them to attend afterwards. We do get a lot of those, but I know it's in the official 6 years we've done this, it's really been hundreds of families have received TBRI training. But that is an area I think Utah can do a lot better on in our adoption arena. And I know nationwide, when we talk about it, that is a tough one in this arena. But that's the current data we take. We're working with our CWIS system to figure out how to do it better and get more information. And then as far as impact goes, I think we see families, again, if we could have the data to say TBRI kept this kid in the home. I don't know that I could tell you that, but I can say in terms of our families talk to us about TBRI as a tool that's finally been helpful, something that has been impactful in their family. And some don't. Some, when you're in one of the hard things in this arena is getting families to come to us not in crisis. Our families are sometimes so heavily in their crisis, it's hard for us to have a conversation about, let's try this TBRI. Let's look at doing some, a lot of our families come to us in a way that says, I'm done. And then we got to try to have a conversation. That's where I think our post-adoption core of clinicians they're just outstanding. They know how to talk with families. They know how to sit there and listen to the pain and then hear what they're saying, but then still be able to say, here's some things we haven't done. I think we can really try to do to help you. And so our families will take it on. And the ones that do and really take it to heart and use the skills, I think are having a really good outcome for them as a family. It doesn't necessarily fix everything, but they get a way to work with the child and remember that, I got to make a connection with this child if I want to do something more with this kid and have our family have some peace. So they're understanding that connection piece. And I think too, the other thing is we see less of these harsh consequences, and I don't know if it's the best way to say it, but a lot of our families sometimes want that pound of flesh because they're that secondary trauma, that vicarious trauma that they're managing with. There's got to be a battle won, and if I can punish this kid to a point that I feel good now, we're seeing less of that. We're seeing families being reasonable with consequences for kids, so that's nice to see. But I think in terms of impact, that's where we're seeing it, is just families being given a tool that they can actually use. And even when we did pathways, it was never really a tool they could use. And not to keep giving a shameless plug to TAC, but it's a good complement to TAC. You have that adoption competency, and then you can talk about the trust-based relational interventions, talk about TBR in a way that connects to all of that stuff. So it's been really nice in terms of our families seeing a tool that they could actually use and, right away. And then when, if Brandy's team comes in and does coaching and kind of gives them examples of how and when and where to use it, I think it just adds to that overall ability for a family to calm and regulate some more. And like I said, it doesn't necessarily stop everything. There's a lot more work that needs to be done in terms of the impact of trauma on these kids and these families. But yeah, I think it's gone a long ways to help family understand how to bring themselves into peace and connect to respite sometimes. Sometimes our families are just so anti-respite, and I think this helps. Brandy, what else do you have?
I would say we feel the same about data and impact. I think we see it, and we feel it, and that's why we keep doing it, is because families continue to ask for it. But we are starting to do much better too, and aligning with those same initiatives with DCFS of needing better data and assessments. I think as social workers, we kind of just do the work because it's the right thing to do, and then we're like, oh shoot, we don't have that data to prove that. And so we are seeing a lot of that. I mean, just in the last year, we've seen impact just with our coaching and our coaching assessments, and there's anywhere from like an 82 to 91% positive feedback on there of families really feeling that there is outcomes they're seeing the positive change. I'm just reading my notes here of like that they can understand how to calm themselves as well as their children after a session, after a difficult situation. They feel like they're getting an understanding better and healthy attachments and ways to build healthy attachment. They are also just noticeably seeing a positive change in their environment in whatever way that they are looking at it. Reduce stress. Also, the ability to anticipate behavior is also rising in our data of after they've had taught the class as well as coaching. And so our data is showing that this does work. It's coinciding with everything that we've seen and felt with our eyes. And the data is showing it too with what we've got. An impact as well. I think that what we've seen is that when we work as partner agencies, what I think I have really appreciated the state of Utah and the DCFS doing is making sure that partners work together, that we don't work in competition with one another. And so, like you said, like Utah Foster Care is the foster care agency. They're TBRI trained. We work really close with them. Children's Service Society is the one who does TAC. And they're also trained in TBRI, but they support that. And we are collaborating with DCFS all the time to make sure that all of the partner agencies have the ability to also be supported in TBRI, and that's been like the biggest impact I've seen. But I don't have like the numbers for it, but I don't think that we would have been able to implement TBRI in a statewide way had that not been set up in a way where partnering is really important.
And I think going back to, how we got this ball rolling is our community wanted it. And, like Brandy was saying, is not just us learning about it and taking some trainings, our community came to us and say, can we do this? Is this something that we can have here? Can we get those services in our homes? And I think that's what pushed our administration to say, let's go ahead and let's get that trained. Let's get our folks trained. And then I think once they saw that, they really saw our partners begin to come to the table and do TBRI. We did have was it 2 years ago or 3 years ago, they came to Utah and did the training. We were able to get a lot of folks done as our partner community to come in and do that training because it was local. There wasn't the added cost of going out of town and the week stay in a hotel. So I think that, if that could happen more often as well, that would be another huge impact for TBRI.
Absolutely.
Any
All
questions?
right. Well, thank you. We are now going to open it up for questions. I'm sure some of you have been waiting with bated breath to ask our presenter some questions and dive a little bit further into implementing TBRI and post-permanency services. So feel free to come on camera, come off mute, or ask your questions in the chat.
So, I was gonna say, I see that there's some, but I was gonna kind of ask similarly because you touched on it briefly about the relationships between the agencies and with the state and really how you worked in partnership, which is hard, I think, for some states to kind of get to that. Can you kind of speak to maybe, did you guys encounter any barriers in that? And how do you keep that going without competing, I guess, with each other?
Well, from my perspective, I don't know that the barriers were relationship issues. I think it really came down to funding and our administration saying, because we originally thought, okay, DCFS was going to kind of carry that ball. But then our partners started to come to the table because, I've been around a long time. I've known Brandy forever. We as a community, most of the folks that do our mental health services, our contracted mental health, are prior DCFS employees that I knew prior. So the relationships have always been there, and I think it's been able for us to talk to each other. So the barrier really has always been funding. Because as we saw more and more partners come to the table, we saw our administration say, well, then let them do it. And so we don't see as many DCFS people. And something I didn't say is for a while there as an agency, they started sending trainers to become practitioners. So we had state trainers that would go in because one of our goals was to train all of our employees to be TBRI trained. And so we started sending them, but that kind of fell off once the provider community picked up the ball and ran. So yeah, for us, it's, I would say it's the Medicaid, it's not being a reimbursable Medicaid intervention. And then the funding, we initially had issues with funding in terms of getting enough people trained, especially in that first group when we sent 10 and lost 4, went to the private sector. Our director got a little mad. And so that was a little bit of a barrier. We probably didn't send anybody to training for a couple of years after that. But then it picked up again like I said, from a partner, our community, they really picked it up. And so the barrier wasn't the partners. We've had one of our goals in the last 5 years is to remove the silos from Utah. You know, when I was talking earlier about our kid versus their kids, is we've really come into a partnership where these are our kids. And so we meet with our, everybody under the DHHS umbrella, really comes to the table, and we have conversations about, these are our kids. How do we help each other? Even to the point we have a program in Utah. It's called the Integrated Services Team. We meet to talk about kids to keep them out of custody, and then how do the agencies that have touched this family's life put in funding to help this family not have this kid come into care based on a need. And so that has never really been a barrier since I've been in. It has been in the past. I won't deny that. But in the last 5 years, it's really been about cooperation, collaboration, and working together. And I think that's why TBRI has grown so much in Utah. But like I said, the barrier is always going to be, and probably will be for a while, that funding.
Yeah, I would agree. I think on our part, it's always been funding as well. When I said we got legislative funding, we went up to the Capitol for the legislative session, and we meet our partners there, Utah Foster Care as well as Children's Service Society. We sit there and we ask for the same pot of money to do the work that we're doing. Same with donors. They will donate to one social services agency a year, you know, and we're all doing the work collaboratively, but they pick one of us, and we never know who they're going to pick of who gets to help. So I would say funding is always a barrier in that. And so that I would agree that the relationship has always been there where we all just want to do the work. I would still even plug TBRI there, that once you're trained in TBRI, it's very hard to not want to do more and collaborate and have good relationships. And so even as professionals, we're using TBRI even in our relationships professionally. So
Okay,
let's see, there's another
thank you.
question.
I see we have a hand raised. Evangel?
Hi. Are you able to hear me?
Yes.
Okay, good. Thank you. I think I have a question that's probably linked to Courtney, who has a question in the chat, in about collecting data. Georgia's at a place that we're looking at how we're collecting our data on all our post-adoption services, and we don't want to fall into the trap of only tracking disruption or disillusion rates, but we're looking at doing surveys and doing some tools to look at how families categorize their resilience or their capacity building. And so I was just wondering what you're using to track as you're beginning to jump into better tracking, to know that what you're doing is effective and to be able to use that. I think that's where we are, is having to look at that. We've got pockets of TBRI in a lot of places, so we are just looking at trying to make it uniform. We've got it in, just several places, and we have a lot of support for TBRI, but we're trying to look at implementation, but I also want to look at data, collecting that data and tracking that to know that it is effective and to be able to use that with our administrators when we're asking for funding. So just anything that you can offer about how you are tracking that.
Wish I could tell you. Oh, I'm not on mute. I thought I was on mute. I wish I could tell you in Utah, this is what we were doing. This was the specific thing that we're really tracking how many families we're training. Brandy may have a different answer, but we're working with our data folks to figure out a better way to, just in general, Utah hasn't been the best on tracking adoption, post-adoption related services. They just had the Protecting American Children and Families Act or whatever that was. It was instituted on October 1st. And we're working on ways to meet that need and collect the right data in our CWIS system. I have for forever wanted something better than we're doing now, but we're finally getting to that place where they're talking to us about how do we do that. So I wish I could tell you there was this thing that we're doing, but we're not.
I think
Brandy?
we're on an uphill battle on that for sure. I think data, whichever one you want to call it, is where we're at on this like uphill battle. But we're like, I feel like we're getting there as far as where we want to be, as a partner agency too with the KPICD, which is the Care and Purvis Institute of Child Development, is where TBRI, the intellectual property belongs to them, of TBRI. And I'm a current mentor for their training, and I will go and help mentor with them. And also an ambassador org with Raise the Future. And we just went and collaborated with a bunch of the other ambassador orgs of TBRI together just last month. And data was everyone's question: how can we do more? And so the Institute is definitely hearing that, and they Texas Christian University is where that institute is housed, and they are on the journey of wanting to become an R1, a research institute. And so they are also working on it. They're aware of the clearinghouse needing to be hired. They are working on that too. So I think all of us is working on the data and how we can get that out more nationwide. As actually it is spread. I saw the question about Portugal. I'm not sure about Portugal. I know we have in Ethiopia. I know we have there's I'll have to look it up on Portugal, and I will look it up, but it's actually a worldwide initiative to spread TBRI, and they are doing that. And so there is data available. It's just who's going to house it is where they're stuck at right now, but it's coming.
Yeah, and I
Thank
think to Anna Paula's question about Portugal, I think you could reach out to TCU and the Care and Purpose Institute and talk about getting that training. Because when we did the training, I think they said there were like 8 or 9 countries represented in our training. So it's available. I think you just have to reach out to the Care and Purpose Institute and start talking to them about training and what that would take. And the other question was, where do you get trained? It's all over the place. Like our group went to Texas. We've had them come to Utah and train. They'll go to different states and train. You just have to go to their website and figure it, and they'll tell you where they're training next.
I did put the link in the chat of for the Institute, and there's all kinds of information on there about resources available. There's resources you can tap into, not being a practitioner, and then also learning how to become a practitioner. They have a blog on there, yeah, different DVD series. They still are selling DVDs, yes, but there is a lot of downloadable applications too.
And I see we have a hand up, Shannon.
Yeah, my question is about Aubrey, when you mentioned requiring like after 90 days of adoption, the TBR training, have you guys noticed like any type of difference in that? Because I know in California we're trying to get some kind of buy-in with the state to have, I don't know, requirement is the right, word or not, but like some kind of connection to us as post-adoption and whoever the agency is. But we would really like to have some kind of post-adoption, like 90 days, a year, or whatever type of training. What can you say a little bit more about that?
Well, with PATH, our requirement was 90 days, and it was just post-placement. It wasn't post-adoption. It was post-placement. We wanted, and what we found was families came prior to that. Families would come in, and we would talk about all this stuff, the things that children would do in homes, and we would get a lot of kind of blank stares, wide eyes. But I think once we introduced post-placement, 90 days post-placement, we saw families come in and were able to have conversations and talk about what they were experiencing. I think that was a big difference. And in terms of like just general and post-adoption, our post-adoption, like I said, our post-adoption clinicians are TBRI practitioners, and they will, if it's needed, go in and train a family just because that family needs it. And the same thing we do with our partners. We'll go into our partners agency and just train them in addition to the trainings we already do. But yeah, one of the things Utah is trying to do from a post-adoption perspective is how do we reach out to families before crisis happens? And then we're working on a plan for, especially in the first 18 months, to reach out to the family every 90 days to see how things are going, and do you need help, and remember that we're out there. So I maybe that's 2 parts to your question, but yeah, currently with TBRI, we don't require the 90 days. They didn't think they could do that because of how much training families went through initially. But a lot of our families don't attend it until they're almost cut to the adoption date. And so most of them are doing the training post-placement.
Oh, wonderful. And Brandy put some information about how many practitioners there are in Portugal. So thank you for that. I did have a question for you. You mentioned using TBRI with birth families. How has that worked?
Um, initially we struggled with that because we didn't feel like we should mix those populations because we have a potential adoptive families who would be in the same group as bio parents that were losing their kids. And so we kind of backed off. And I know we had a particular practitioner in Utah that was giving it a shot. And it really is what we found hard was that a lot of times our families aren't in a place where they can listen to what their behaviors were and how they affected their children. So the trauma caused by our parents isn't something that is easy. They have to be ready for that. And so that's been kind of a barrier in terms of how do we work with biofamilies. We still do it, but they have to be in a place where they can hear that. If they're not able to hear it, then it's really not a good place for them. So it's really maybe, and I don't know, Brandon, you can probably talk better too, because you're with that agency. But it was really about working with the family until we could do TBR, if that makes sense. Brandy?
Yeah, I would say the same that what we learned is that primary families definitely needed to be ready to hear the information about TBRI. That communication though has been received by the KPICD, and they just recently dropped a new caregiver series. So the old caregiver series, and it's not old, but it was old enough that it was very adoption specific. And what we have learned through even the Institute is that anyone can do TBRI. It doesn't have to be. It was created to help adoptive families, but what we learned through it is that the principles are just as impactful for any family or any person. And so they just recreated a new caregiver series, and our partner agency, Utah Foster Care, is specifically using that to pilot a full primary or biological family cohort themselves. And because we have had to more do it in a way where they're either part of the mixed group and they're willing to and understand about being part of that mixed group, or some of our coaches has also just taken them one-on-one and we got worked through the curriculum together. So it was more geared towards their own experiences and not something that they'd have to hear as a whole.
Okay. So as we wind down, what are some takeaways that our participants can glean from your presentation about implementing TBRI in post-permanency? What are some of those good tidbits that they can use?
For me, I would say is that it really comes from us, the people on the front lines who are doing the work, to say, this is a tool that I could use. This is something that I could really sit down with a family and actually teach them something that's meaningful to them, and that they can, when I leave that day, something they can do. But I think in terms of getting it implemented as a program for your state is being heard, is keep talking, keep saying and keep pushing that envelope, and saying, hey, we need to do this. This is why we need to do it. And this is the stuff that we've learned. And so that's what got us to a place where I think our director, that director at that time, she was like, okay, we're going to send you to this, but you got to bring it back and make something out of it. And so for her, I think I don't know that she was sold on it as much as she was tired of us talking about it. And so she stepped up and said, we'll do this then. And it was our 40 savings money that they used at that time. So it didn't come directly out of the state budget in terms of that, of other funding. It came out of that maintenance of effort funding, which is an allowable expense within that funding. And it went to benefit families, but and it kicked off and it took hope. So that would be my big takeaway is don't stop fighting the fight, because it took us a while to get that to that place.
Yeah, and I would say allow people to be curious because it will speak for itself. There's once you get TBRI, you really want everybody to have it, and it's really easy to just be like, give everything that you can possibly give to everyone, and sometimes you need to meet them where they're at and make sure that they are in a space to receive it, and being really curious to explore TBRI because there is a lot that goes into it. It's not just a curriculum, which is why it's blown up the way it has, is because yes, it may start with the book that you read or something that mentions TBRI, or you went to an intro and overview. Even the caregiver series really isn't what TBRI completely is. It really is a lens that we're all working through. And so allow people to be curious, explore it, let them immerse themselves in it, and then extend it in a way. What I would also say is that making sure that you have champions in your room, because had not DCFS been supportive of it and champion us to do it, we wouldn't be where we're at right now.
Awesome. Can caregivers become TBRI practitioners?
Yes. Yes, anyone can become a TBRI practitioner. It is not a clinical modality. It can be used in clinical, and so parents, teachers, anyone can become a TBRI practitioner.
Okay. Wonderful.
And the training's
Any
awesome. The folks you train with and the train, I'm a very introvert. I'm very introverted. And they put you out of your comfort zone and you really kind of come from the perspective of your families and the kids. So it's a very good training. It's not one that you go with there and say, man, where did that week go? You're at the end of it. You're like, could this be a little bit longer? Could we get more? It was a good training. It's a good training. It's worthwhile.